High care at the Hani Baragwanath Academic Hospital is expected to improve after an upgrade of its 24-bed acute care unit. Gauteng Health MEC Nomonde Mqhayi-Mbambo says the development will improve patient experiences. Well, let's bring in Dr. Nomonde Mqhayi-Mbambo, Clinical Director for Medical and Psychiatry Units at Hani Baragwanath Academic Hospital. Dr. Nomonde, appreciate your time this afternoon. Lovely to speak to you. So let's start off with the acute care and the services that are offered in this ward, if you will.
Thank you very much, and good afternoon to your listeners, and thanks for the opportunity. Our newly refurbished medical acute care unit is actually allocated to assist our critically ill medical patients that come in. Some of them might be in need of being ventilated, meaning that they need to be supported in terms of breathing, and then they might need to be put in on equipment. And also for those that need support for their organs, particularly those patients of ours who've got challenges with their kidneys that might require renal dialysis. As a result, we have refurbished our units to accommodate the plumbing services so that they can accommodate renal dialysis machines, which is very critical because you know that kidneys are very important in the body in assisting the body to be able to filter the blood and clean the blood. So those are the services that we are going to be providing. But it also helps those that do not necessarily need to be ventilated but need non-invasive procedures, and also those that might need high flow oxygen, like for example those that when we had COVID, not all patients qualified for ventilation, but we found that high flow oxygen was life-saving. So these are the services that we'll be able to provide in this new service area that we've just refurbished.
Well, Dr. Nomonde, we talk about an upgrade, which is a marvelous word. Now, where have you upgraded from? Where are we now versus where you were before?
What we had before, we were only able to accommodate 12 patients before, but then with the upgrade now we're able to accommodate 22 patients, and then 2 of those are isolation. I think we've learned our lesson from COVID-19 that some diseases are infectious, therefore you need to be able to have a space that is specialized, that is able to keep those that are infectious, so those 2 isolation. And what we've also done is that the electronic devices, because of the challenges that we had with COVID, are now have been upgraded to have a UPS, meaning that even if we have got load shedding, our patients that are on ventilated machines will also continue for the machines to operate. And also the lighting system has also been upgraded such that the bed, each and every patient individual bed has got their own individual light. So in an event that we have load shedding, the doctors are not going to use their cell phones to light the patient beds, but those lights will be able to be lighted. And we also have got emergency lights. But what also has been upgraded in a high care environment, we've got bed units that accommodate different plugs, because we've got plugs for suction, we've got plugs for oxygen, we've got plugs for medical air. So now we've got, instead of the previous 4, we're able then to put up to 8 plugs per patient bed to accommodate even the different monitors. As I've indicated, some patients might come in requiring with a kidney failure, requiring additional machines. So all the other different machines that might be required per patient have been upgraded. The environment, also the look and feel of the ward has been improved. We have repainted the unit. So there's quite a lot of upgrading that has undertaken.
Dr. Nomonde, a lot of the conversation around health establishments in the country that we've certainly had over the last few months have all painted a very negative picture. It's all been complaint upon complaint because the service delivery or the quality of service that is offered is poor. So obviously a doubling of capacity is a huge milestone. Now, talk to us how much impact this is going to have, the fact that you are now going from a 12-bed unit to a 22, in fact, plus the other 2 to make it a 24-bed unit.
For us, it actually has become a double blessing, because not only is it going to improve patients' experience of care, because one of the major the priorities of the department is improving patient experience of care. So it's also going to improve patient experience of care. It's also going to improve the experience of the relatives, because remember, this are critically ill patients that the families come in, they are concerned about them. So when they come in and they find this newly refurbished environment, then they also will be more comforted in realizing that their patients are being taken care of. But one of the things that we picked up, there's also an improved environment for the staff, because one of the challenges and major complaints that we experience is on staff attitude. But now that the environment and the services are available, there's less overcrowding that is going to be in the ward. More patients are going to be able to be accommodated. So it makes it a blessing not only for the patients but also for the staff, because now the environment that they are working on, because I can attest that the staff that is working in the public sector are very dedicated staff, because they are working under very strenuous conditions, but each and every day they wake up and they want to give the best for their patients.
Now, we talked about in the intro about the MSc for Health in Gauteng, Nomonde Mqhayi-Mbambo, saying that this is a new beginning. Are you aware of what the next plans are? When you've achieved this, you've got a 24-bed facility. Is there more to come?
I would say that there is more to come, because there is a plan that has been undertaken by the department. Recently, our department had the strategic plan session, because we wanted to look, because if you would check now, we are in the midterm of the 5-year term and towards the end. So then we just had to take a pause as a department to ask, where do we come from, and have we achieved what we wanted to achieve, and are we going to achieve more? So one of the biggest challenges that are limited our successes has been infrastructure. That is why, if you've been noticing and been observing the MEC recently, you would have realized that she has been going in other facilities, looking at and opening up refurbishments, because as I've indicated, we want to improve patients' experience of care. We want to actually also improve clinical outcomes. But as a department, we're gearing ourselves for the national health insurance. So for us to be able to qualify and be able to provide those services, we need to improve the environment and the conditions where we're working on. So those are not just the only programs that are in place. We're also looking at ensuring that occupational health and safety is improved. We're looking at ensuring that our staff are working under conditions, because we value our staff. So we want to make sure that the staff are working under a conducive environment. So one of the major programs that the department is looking at is employee value proposition, to make sure that we honor and appreciate the staff.
Dr. Nomonde, appreciate your time. Dr. Nomonde Mqhayi-Mbambo is the Clinical Director for Medical and Psychiatry Units at the Hani Baragwanath Hospital.